Good day, folks. Thank you for joining us here at Your Health. On today's program, we have a very special guest. Dr. Jeffrey Anshel joins us. He wants to talk about his new book, and I want to talk about it too, Smart Medicine for Your Eyes. This book is it's a home health book that gives you guidelines so you know how to better treat your eye conditions. And it's fantastic. I've never seen a book like it on the market, and it's something that every family should have in their library at home. It has homeopathic remedies, herbal remedies, vitamins, and other nutrients that help support the better eye health, and a diet plan. It's tremendous. So stick around for this. I think you'll learn a lot from Dr. Anshel, and plus he's just a great guy. First, let's go to our news. Let's see what's happening in the health world. Eating 2 large meals a day may better control adult-onset diabetes than eating 6 small meals with equal nutrients. Doctors have long recommended type 2 diabetics should eat smaller and more frequent meals for better control of their diabetes. New research conducted in the Czech Republic and published in Diabetologia compared the effect of 2 meals a day versus 6 meals on 54 overweight adult-onset diabetics. The study was a crossover design, meaning both groups of dieters had a try at the 2 meal and 6 meals a day diets for 12 weeks over the 24-week study. They found when the diabetics ate 2 meals a day, they lost more weight, they had a greater reduction in liver fat and lower fasting blood glucose levels, they had lower insulin levels and less insulin resistance. Folks, doctors have been advising diabetic patients to stretch their daily meals out to 4 or 5 or even 6 meals a day to better control the parameters of diabetes. And they've been doing this for at least 50 years. This is the first study that I'm aware of that counters that long-held wisdom. This study found that having just 2 meals, breakfast and lunch, with equal calories and total nutrition controlled type 2 diabetes better than the traditional 6 meals. The study found when the test subject consumed the 2-meal plan, it led to greater weight loss and reduction of liver fat, lower fasting blood glucose levels, insulin levels, and less insulin resistance. And folks, these are all very good things. Eating 2 meals a day is certainly more convenient than eating 6, plus eating just breakfast and lunch, and it's important, it's breakfast and lunch. We're not skipping breakfast here. Breakfast and lunch provides the diabetic with a mini fast for about 18 hours from lunch until the next day's breakfast, which provides benefits as well. The researchers say they are not ready to recommend that all diabetics change to the 2-meal plan just yet, as this was the first small study to make this finding. So do not change over to the 2-meal plan based solely on this study. However, more trials are underway as we speak to either debunk or confirm this new study. As these studies become available, we will of course keep you up to date. Men who exercise are less likely to have nocturia or awakening frequently at night to urinate. Researchers from Loyola University evaluated health and exercise data on over 28,000 men enrolled in the prostate, lung, colorectal, and ovarian cancer screening trial. They found the men that exercise at least 1 hour a week were 13% less likely to report nocturia and 34% less likely to report severe nocturia. The study was published in Medicine and Science and Sports and Exercise. Related research from UT Southwestern Medical Center published in Mayo Clinic Proceedings finds sitting for just 2 hours is as detrimental to health as 20 minutes of exercise is beneficial to health. And finally, from the University of Montreal, researchers find regular exercise helps to preserve blood vessel elasticity, which in turn helps to preserve mental abilities. Nocturia, or wakening more than twice a night to urinate, is the most common lower urinary tract symptom men experience with increasing age. At least half of all men over 45 years experience nocturia. The most common cause of nocturia is enlargement of the prostate gland. It is not unusual for men with advanced or severe prostate enlargement to awaken 4 or more times every night just to urinate. This will, of course, lead to sleep disturbances and declining health overall. This study suggests that nocturia of prostate enlargement can be countered by regular exercise. It is also relevant to mention saw palmetto has been shown to help reduce nighttime awakenings as well. Other exercise-related research shows regular exercise helps to keep our blood vessels soft and flexible, and this in turn helps to preserve our mental abilities, as hardening of the arteries is a known cause of vascular dementia, the second most common cause of dementia after Alzheimer's disease. And finally, it takes 20 minutes of exercise to counter the health hazard of just 2 hours of sedentary behavior, or for example, sitting for 2 hours to work on the computer. All of these are but gentle reminders that regular exercise is an essential component of a healthy lifestyle. Well, today on Your Health, we have a special guest. Dr. Jeffrey Anshel joins us to discuss his wonderful book, Smart Medicine for Your Eyes. Stay tuned. We'll be back.
Savings time is here again with our annual cancer-free celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioInnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's Bionutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. I'm Cindy Becker for Your Health at a Glance. We all have said, I need to get some exercise, but how many of us put on our walking shoes and go? Learning a little more about the health benefits of exercise may help you get motivated to lace up those walking shoes. Exercise helps to control our appetite and weight. It maintains strong muscles. It promotes the release of endorphins that counter depression while helping us feel good about our lives. Exercise helps to lower blood glucose, promotes a strong circulatory system, and controls cholesterol. Exercise even helps us get a good night's sleep. Recent research finds dog owners who regularly walk their pet are 34% more likely to achieve fitness goals. You can get all of these health benefits by walking 30 minutes 4 times a week. Just 30 minutes a day. Start today, and you'll start to get all those benefits. For Your Health at a Glance, I'm Cindy Becker.
Can you lower your risk of disease? The answer is yes. One way is by including fruit in your diet. Fruit contains valuable nutrients that can reduce the risk of heart disease, stroke, and even some cancers.
We've searched the world and found 4 fruits we believe are among the best. Noni from Polynesia, acai from the Amazon, and 2 new ones, goji and mangosteen.
These 4 juices each have amazing properties that make them great additions to your nutritional plan. If you're a diabetic or have chronic pain, these juices will help you feel better and have more energy. Plus, they help with digestion.
Now you can experience the health-promoting benefits of all 4 in one convenient package we call the Fruits of the World 4-pack. And remember, it's 50% off by the case. Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128.
Welcome back, folks. Today we have a special guest joining us. It's Dr. Jeffrey Anshel. He's an alumnus of the Illinois College of Optometry and a veteran of the U.S. Navy, where he started the Navy's first vision therapy center. Dr. Anshel is the founder of Corporate Vision Consulting and a past president and founder of the Ocular Nutrition Society. Additionally, he has been an assistant professor at Southern California College of Optometry, and he maintains a full-service practice in Encinitas, California. Nothing replaces patient contact in the art of medicine and optometry, right?
Absolutely.
We learn so much from our patients.
Yes, we have to talk to them to find out what's going on.
We do, we do. You know, I can honestly say I've learned more from my patients than any book.
Absolutely. Well, when you graduate from medical school, your education begins.
It really does. It really does.
Yeah.
The practical part, at least.
Absolutely.
Let's start about eye. by understanding more how the eye works. We take it so for granted. These two things on our face, and it opens the whole world to us. Help us better understand how the eye works.
Well, we are visually directed beings.
Yes.
In other words, 80% of our learning comes through our eyes. So if we see, as they say, seeing is believing.
Yes.
So if we see something, we know it's true. So our eyes basically are receivers of light, and they take that light and transform it into nerve energy, and it goes back to the brain for interpretation. So the eyeballs themselves are literally just those receivers of light, but the actual process of vision involves the brain and the interpretation of what we're seeing and how we interact with our environment. So it's fascinating.
So if we begin to lose our vision, can you talk a little bit about the psychological impact? That'd be a huge adjustment to blindness.
The good news is we can adjust, because there are obviously people who go blind and are able to adjust and still function in society.
Right.
But, again, since so much of our learning and our interaction with our environment is through our eyes, it's a very frustrating process.
Yes. What are the greatest threats to our vision? What's out there to damage us?
Well, ironically, the sun is a big part of it, because the intensity of the sun being outside a lot can actually, over time, stress the eyes to the point where it starts to break down some of the cells in the eye. So we have the ultraviolet radiation and the high energy blue light and things like that. And we're in our environment, we're in highly reflective surfaces. We're on water sometimes. We're getting reflections off of water. So it's very important to protect our eyes. That's where sunglasses come in when we're outdoors. And taking care of our eyes as far as, making sure they're protected.
Other threats. How about our nutrition?
Well, actually, that's one of the biggest ones, because we need to realize that the eyes are connected to the body. So we talk about nutrition for different aspects of our heart and our brain health and all these other things, but our eyes are equally as important, or more so, in getting the proper nutrition to maintain their function properly. And basically, what's good for the body is good for the eyes. So we need to, rethink all this and expand it to knowing that we need to eat properly to see better. And it's more than just eating carrots.
Yes.
Okay, your mom told you need to eat carrots to see better. Well, that's a bit of a fallacy, because there's beta carotene in carrots, and this beta carotene will convert to vitamin A in the body.
Which is essential for
Which
vision.
is essential,
Okay.
right. And this vitamin A is that molecule in the retina that transforms light energy into nerve energy, which goes back to the brain. So yes, beta carotene, if you look at it like that, beta carotene important for vision. However, the beta carotene does not convert to vitamin A if the body doesn't need any more vitamin A, because it's stored in our liver. And also, beta carotene is competitive with the other molecules that do center themselves in the eye, lutein and zeaxanthin. These are the molecules that are important for protection of the back of the eye.
Yeah.
So they compete with each other. So while you're not going to get too much beta carotene just by eating carrots, if you're drinking a lot of carrot juice or having beta carotene in your multivitamin, you can overdose on beta carotene. Could be detrimental to your eyes.
Yeah. It seems everyone, especially our seniors, are on 2, 3, 4, 5 medicines.
Right.
And we don't often hear about side effects of our common medicines in the eye, but I would imagine they play a role in eye problems, don't they?
Well, they can, because if you're reducing inflammation or these inflammatory cells on some level, the body has inflammation for a reason, and that's to fight infections and different body functions. So you need to balance things out to make sure the body's able to heal itself. Now, we can use some medications on a short-term basis, to get you over the hump, if you will, but you don't want to be using these things on a long-term basis.
What about computers? Do you think they're damaging? I know they can give you eye strain and make your eyes feel dry. But could it be possible that they actually damage the eyes?
Unlikely.
Okay. That's good news.
Yeah, that is the good news, right? Because we hear about now how blue light coming out of computers is ruining our eyes and potential for macular degeneration. And there have been no studies that actually give a direct causal link between computer use and macular degeneration. So that's speculative.
Okay.
So we think it might have something to do with it, but it's really not been proven.
Yeah.
Using computers, the problem is we're using them all the time.
Yes, we are.
We're just using them all the time. And there are studies that show we do blink less, and that's where the dry eyes come in. So we blink less and we blink incompletely. Our blinking is just halfway instead of full blinks. So there are some issues with computer use, and you know, I tell people to follow the 3B approach: blink, breathe, and break.
Yes.
You know, take some breaks. Don't be staring at a computer screen for hours at a time.
You know, I've seen that people are using amber glasses to filter the blue light from the computer. Is there something to that? Is that helpful?
To some degree. You know, again, there is some blue light coming out of the computer screens, but again, and it can, the main thing it does is affects our sleep.
Oh, yes.
The melatonin production. So that's a huge issue that we need to address. So you should not be looking at an iPad type of device or any kind of a pad in 2 hours before you go to sleep.
So clarify, you say the light, the melatonin, we're familiar with the notion that melatonin helps to induce sleep, but the eyes are involved in this.
Well, there are receptors in the retina that don't transmit the nerve impulses to the brain for vision, but actually control the melatonin release. It's called our day and night cycle, visual cycle, if you will. So it actually helps. That's why when we wake up, we see blue sky, and that blue light helps to energize us.
Right.
But if we're getting blue light off of computer screens just before we go to sleep, our brains are energized.
Yeah,
so
that doesn't help.
We're kind of fighting against a sleep factor.
Let's talk about what we should expect from a good eye exam. I've heard doctors say, well, you should have your eyes examined every other year or so. And I'm thinking, well, not if I don't have a problem. That's short-sighted, though, isn't it, really?
Ironic that you would put it that way. Yes, you put it very well. Yeah. Most vision problems are painless and slow to develop. So actually, when I give presentations to consumers, I do have a slide that has the inside of the eye with the 20/20 points, and the title of the slide is, "I see just fine." And this vision is 20/20, this vision is 20/20, and what's the difference? One eye has a malignant melanoma.
Oh, my goodness.
And that's cancer. And you would never know it because the eye is still seeing 20/20.
My goodness.
So it's not just the 20/20 part of it. It's getting the health aspects of the eye. Years ago, real briefly, I was in the Navy. I was examining recruits in the Navy. And this one recruit, I got his vision to 20/20. He says, but sometimes off to the side, I have some difficulty seeing. Yeah. But it's just occasional. Long story short, I found a tumor, a pituitary tumor.
Oh, my.
So it was very devastating, but it came out as a visual problem that he didn't even notice.
So I've been taught in medical school that when you do a proper eye exam, you can actually see blood vessels and nerves that you can't see anywhere else in the body.
Right, we see the blood vessels in their active state without having to cut open the body. This is literally a window inside the body. So these blood vessels are as all blood vessels are, connected to the heart. So if there's heart issues, if there's hypertension, if there's, diabetes, we can see a lot of these things just by looking in the eye.
So you can do a vascular checkup just by looking in the back of the eye.
Absolutely.
Isn't that? How often should we do this?
Well, typically I like to tell people every year because maybe they'll come back every year and a half or 2 years. So, every year there can be some changes.
Is it a good idea to have the eye dilated with every exam?
Absolutely.
Tell us about that, why it's important.
Well, we have to light up the inside of the eye to see inside, and when you light it up, the pupil gets real small.
Yeah, it's a bright light.
So it's very hard to see. So we have to dilate the pupil so we get a view of the whole back of the eye, the retina itself.
Yeah. So when we dilate, we can see it better.
Right.
And sometimes you'll even take a photograph to compare.
The best part is taking a photograph so you can go year to year and see comparisons of changes that might be happening over time.
All right. Good. Folks, we have a break. We'll be right back.
Time is here again with our annual cancer-free celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioInnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them them a try.
Dr. Becker's Bionutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
I'm Dr. Richard Becker, and this is Your Health at a Glance. Are you sleepy during the day? Many Americans are in a sleep crisis. They aren't getting a good night's sleep, so they suffer from daytime sleepiness. The reason may surprise you. You may be deficient in vitamin D. According to recent research, vitamin D deficiency leads to poor sleep quality. If you aren't sleeping well at night, you are sleepy during the day. Vitamin D and the hormone melatonin are critical to our sleep cycles. Both are tied to sunlight. This is one of the many reasons why working night shift hours can be so hard on the body. So, if you're finding yourself nodding off during the day, before you turn to another cup of coffee, try some of the sunshine vitamin and see how vitamin D can help you get a good night's sleep. For Your Health at a Glance, I'm Dr. Richard Becker.
Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with gastrodefense technology. This system protects the good bacteria from stomach acid so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford. Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128.
We're back. We've been talking with Dr. Jeffrey Anshel about his book, Smart Medicine for Your Eyes. This is really a tremendous book. He goes through a wide variety of eye conditions and gives you effective therapies that are nutrition-based, gives you a little background on what the eye surgeon may do for you. Doctor, as we go into the eye doctor to get a good exam, let's start with what's the difference between an ophthalmologist and an optometrist, and then let's talk about the most common eye conditions you see and the most serious ones.
Sure.
The two types of eye doctors.
Well, an optometrist goes through 4 years of optometry school and an internship.
That's extensive training.
Yes, absolutely. We're the general practitioners of eye care.
Okay.
We cover everything, do contact lenses, glasses, and also vision therapy, and training the eyes. And because the eyes are connected to the brain, there's a section of eye doctors who deal with things like traumatic brain injury and dyslexia, ADHD, learning problems. So these all have a visual component to them, so we can deal with those as well.
Let me cut to the chase. If I'm concerned that I may have a disease of the eye, not just a new prescription for my eyeglasses, is it okay to see an optometrist to start?
Absolutely. Sure. We are well trained in detecting any eye disease. And in most states, we can treat most of them as well. So it depends on what it is. And when I work with patients, if I find something, maybe I have a retinal specialist I'll send to,
Sure.
or a corneal specialist.
Well, we
if it's
need our
something-
surgeons.
Right,
We gotta have
exactly. And those are the ophthalmologists. They're all surgeons, and they will treat eye diseases and do surgery. We can detect diseases, and we treat a lot of them. And if it's beyond our purview, we'll send off to an ophthalmologist.
Yes, excellent. When you're doing a proper eye exam, tell me some of the conditions you're specifically looking for.
Well, besides the visual part, we look to make sure people's vision is good, and certainly in children, we look to make sure they have proper focusing ability and eye coordination. Those are not diseases; those are what we call functional problems. So we have that part of it. On the disease part, we go through glaucoma, cataracts, macular degeneration, and diabetic retinopathy, and also dry eye.
I don't want any of those, right?
You don't want any of those, right?
Glaucoma. What is it?
Glaucoma is an increased pressure inside the eye that causes a degeneration of the optic nerve.
Do we know why this happens?
Well, it's a challenge. We don't really know what causes it, because typically with glaucoma, we have a high eye pressure. However, there are some people that have a high eye pressure and their optic nerve is in fine shape. So they have ocular hypertension. And then we have people who have normal eye pressure and their optic nerve is degenerating, like the pressure's high.
Yeah.
So that is called low tension glaucoma.
It's complicated.
Yeah, so it is very complicated.
But it can still rob you of your vision.
Yeah, absolutely. And the challenge on that one is when you do lose vision, is from the sides. So this is where you get your tunnel vision, but you see clear 20/20 the whole time, but you're losing your side vision.
You may not notice that.
Exactly. That's the biggest problem.
Is it typically painful, this process?
No pain at all.
No warnings then, other than
warning signs.
Slowly.
Not even.
There's another condition where you lose the center vision and the side is better.
Kind of the opposite, and that's macular degeneration.
That can be serious too.
Extremely, because the macula is the central part of the retina where we get our finest vision. And
so if I'm reading, I'm using that macula.
You're using your macula for everything you look at. You're using your macula.
Yes.
So we use it for a lot. Yeah. It's the highest energy light that we have in the retina. And over time, and typically with age, this can start to degenerate, because when these retinal cells start to regenerate themselves, they shuttle out some of the debris into the bloodstream, and this debris may not get shuttled out properly because the mechanism may break down with age. So this debris builds up, and we see these little yellow spots called drusen, and they start accumulating in the macular area, and we start losing our vision.
Are the things we've heard a lot about the laser therapy for macular degeneration, and I think a lot of people assume that it is the cure-all for this condition, but that's not necessary. There are limits.
Absolutely. If it's in direct center of the macula and we use a laser, what we're doing is just sealing off the blood vessels and causing a scar. Well, you can't see through a scar either, so you're still going to lose vision if you do this in the center of the macula.
So it's like the little Dutch boy putting his finger in the dam. It's not complete therapy.
No, it doesn't really work that well. There is no typical medical therapy for the early stages of macular degeneration. What they do have is something for late stages or wet macular degeneration, and that is an anti-cancer medication that they shoot into the back of the eye to help reduce with a needle in the back of the eye.
Oh boy.
It's not as painful as you might think. It's very uncomfortable, but it's not like going through the center of the front.
We're trying to save our vision, so I'll put up with a little discomfort to save my
The problem is the shot only lasts about 4 to 6 weeks.
Oh, that is not
6 to 8 weeks maybe, but you have to have them several times a year.
You've learned in your studies that there are things we can do to help lower our risk for macular degeneration. Let's talk about that, because that's what we're all about here, is prevention and using natural measures to help people.
Well, the first thing is smoking, because we found that there's a direct link between smokers and development of macular degeneration. So if you're a smoker, it's never too late to stop. And then the proper nutrients to help support the protective factors in the macular area. We have molecules called carotenoids. Beta-carotene is one, but it doesn't really center in the back of the eye. 2 other ones are called lutein and zeaxanthin. We've heard more about these more recently. So these are the things that will accumulate in the center of the eye, help filter out that high energy blue light, so the rods and cones are more protected.
Is it true that measures to help prevent diabetes or to treat diabetes, measures to help with vascular disease, hypertension, high cholesterol, they help the eye health as well and may help reduce the risk for macular degeneration?
Absolutely.
All this is true.
Right.
So what's good for the goose is good for the gander, so to speak.
There you go.
Right?
Well, again, the eyes are part of the body. You need to support the body and to heal itself and to support itself. Same thing with eyes.
You know, there seems to be a particular disconnect between the eyes being part of the body. I think people are getting the heart as part of the body. You know, we can't just separate with heart disease and the stomach and everything else, but there seems to be a disconnection between that and the eyes.
Well, the disconnect, I think, is coming from the fact that our vision versus, the health of our eyes.
Yes.
Okay? Because we always think, I see 20/20, I see fine.
There you go.
Okay? If I have perfect vision, which 20/20 just means you see at 20 feet, which you should see at 20 feet.
Yeah.
So, some people see 20/15, which is better than 20/20. But again, if we see fine, we think everything is fine.
Yeah.
And we don't relate that to the health of the eye.
in the little time that's left, cataracts. Everyone gets cataracts as they age, right? It's inevitable?
That's what I've been told, and actually that seems to be the way it goes. Very few people get by without getting cataracts.
What is a cataract?
All right, the lens inside our eye that changes focus as we look from far to near.
How we focus our eye.
Right, when we look from far away to up close, we go back and forth. We flex the lens, okay? This lens obviously needs to be clear to get light through it. As we age, it gets thicker and thicker and thicker with age. It continues to grow. Okay?
Is that also why I can't see up close?
Exactly. Same thing. Its flexibility is less. Okay? Now, it also doesn't have any blood vessels because you can't see through blood. So it relies on fluids having nutrients in them in the eye to fuse into the center of the lens.
Osmosis.
Exactly.
As it were.
So as it gets thicker and thicker, it gets more difficult to get those nutrients to the center part of the lens, and those fibers start to break down, they lose their integrity, and they get cloudy. And so a cloudy lens is a cataract.
A cataract, like a waterfall, it has that cloudy appearance. That's what that means?
Right.
Yeah.
Yep.
So we're all going to get it if we live long enough?
Theoretically, yes. But nutrients like antioxidants can help at least delay it a little bit. That's really all we know. But the good news is it's the most common surgery done in the country today, so they're
good at fixing them.
They're good at fixing them.
We're going to talk more about the nutrition in the eye when we return.
Savings time is here again with our annual cancer-free celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioInnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's Bionutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
I'm Dr. Richard Becker for Your Health at a Glance. High cholesterol raises your risk for cardiovascular disease, but it's just one risk factor among many. And the need to lower your cholesterol can be over-exaggerated. Everywhere in the media, we see advertisements for cholesterol-lowering prescription drugs. It's a big business. Now, cardiovascular disease kills more Americans than any other disease, so we need to pay attention to all the risk factors for heart disease. Here's a prevention strategy. Besides lowering your cholesterol, treat high blood pressure. Stop all tobacco, manage diabetes, exercise regularly to stay fit, avoid sugar, eat fish and fresh fruits and vegetables. Take your daily vitamin and use omega-3 oils. Address all your risk factors, not just your cholesterol. For Your Health at a Glance, I'm Dr. Richard Becker. For thousands of years, Eastern health practitioners have used mushrooms for a variety of treatments.
And recently, scientists everywhere in the world have turned to mushrooms in search of health-promoting compounds.
These are known as medicinal mushrooms. Among some of the most potent are ABM, maitake, reishi, shiitake, and cordyceps sinensis.
At BioInnovations, we've made available 4 of the most powerful mushrooms in one easy-to-use formula. We call it the Mushroom Complex. We also offer the amazing mushroom cordyceps sinensis in a standalone formula.
Cordyceps helps boost energy, an amazing discovery now used in both Eastern and Western medicine. So take advantage of thousands of years of health knowledge.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. To help you get a copy of Dr. Anshel's book, Smart Medicine for Your Eyes, we have a great special for you today. With your purchase of a case of Noni, whichever type you want, the regular, organic, or concentrate, you'll get Dr. Anshel's book on maintaining eye health free. This is a great opportunity to also get an extra copy to share with your doctor or a friend who needs it. The special is for today only, so be sure to call and get yours soon.
We're back, folks. We're talking with Dr. Anshel about his book, Smart Medicine for Your Eyes. This is a great reference to have at home. You can look up your eye condition and learn about the natural measures you can use to help support your eye health. You can learn more about what the ophthalmologist will do and what the optometrist will do as well. We were talking about cataracts. And I think most people have the notion that the cataract has to mature, there's nothing you can do, and it gets to the point where the eye surgeon can take it out, and that's good, that's appropriate, but I can't help but believe there are things we can do to help delay or even prevent these cataracts. Is there anything?
Well, there are studies out that do show that high-potency antioxidants have an effect.
Okay.
So it kind of makes sense because, as I mentioned, the lens requires to get its nutrition from the fluid surrounding it.
Right.
Okay,
right.
so the main fluid is between the cornea and the lens, and that fluid, called the aqueous humor,
Yes.
it has 26 times more vitamin C in it than any other fluid in the body.
Maybe there's a purpose for all
So
that
there you go.
vitamin
You would
C.
think, though, okay, if it has that much vitamin C, why?
It's a strong antioxidant.
Exactly.
Trying to prevent the cataract.
high-potency antioxidants. And some people may run into a product called Can-C, which is, you may see it on the internet.
Yes, I've seen that.
It's another high-potency antioxidant as well.
Does it work?
Well, it's been shown to work in rabbits and dogs.
Okay.
So
it's a start.
It's a start, and they're still working on. The FDA has been having pros and cons going back and forth on whether to approve it or not, but it does have some potential.
I've heard it stings the eye a little bit. Have you found that to be true?
Some people have noticed that it stings, but the other thing too is that cataracts don't form overnight, and so they're not going to disappear overnight.
No.
So the problem is, you're going to have to be using these drops for up to a year, maybe 2 years, or maybe even more.
But if we intervene
earlier is
and
better.
engage in a diet high in antioxidants, which is basically a plant-based diet.
A lot
correct?
of it is.
A lot
Absolutely.
of plant-based diets.
Right.
A little extra vitamin C, a good vitamin program with antioxidants, and there's a good chance that we can stall and delay these cataracts.
Absolutely.
If I'm struggling with cataracts, what is my vision like? What do I see?
It's just like there's a little grease on the lens. It's a little hazy.
Yeah.
Okay. Light's going to scatter a little bit. And the number one symptom I typically hear is, I can't drive at night anymore because the lights are too glary.
And that
Again, because what happens at night, the pupil gets a little bit bigger, and sometimes the cataract comes in from the sides, and it may not be noticeable during the day when the pupil's small, and you widen it out,
Yes.
and you're seeing some of it now. It's scattering the light.
So that
and you
cloudy
get
haziness of the lens, it diffracts the light, spreads
Exactly.
it all around, and makes it look like there is a grease smudge.
Exactly.
That's an interesting way of putting it. I think someone's going, that's exactly how my vision is right now.
I hear that a lot, actually.
So when the doctor says it's not ripe yet, what does that mean?
Well, in the old days, when they were doing surgeries, they needed to make sure the lens had a certain point where they could just kind of freeze it and yank it out of there.
Okay.
They don't do that anymore.
Don't do it. They have a new approach.
Actually, for the last 40 or 50 years.
Well, you still hear the term.
Well, you do, but typically you don't need to.
Okay.
I've had patients come in and they're just starting to get their cataracts. So, well, it's going to be covered by insurance, so I'll go ahead and get it done now.
Yeah.
So basically what they do is they have a dual probe that goes into the eye, very numb, okay?
Yes.
And one probe has like a reciprocating saw, and it chops up the lens, and the other probe is a vacuum that sucks it out. It sounds pretty intense.
But you can see it.
But it works pretty well, and then they take a new lens and insert it. That compensates for the prescription difference.
Right.
So whatever your distance prescription is, if you have a prescription for distance, you can get it resolved with the internal contact lens that they use to replace the lens.
And they do so many of them today.
The most common surgery done in the country.
Yeah, so it's really not to be feared.
No,
but if we can prevent them, we're going to try.
Yeah, keeping your own lens is always good.
Another common eye condition, dry eye. Tell us about it.
Well, again, this one's under the radar because it's not sight-threatening, but it is uncomfortable.
It sure is annoying.
It's annoying, uncomfortable, and it can interfere with your daily lifestyle. Basically, the tears, people tend to think that the cornea, the front surface of the eye, is the first surface the light hits when it goes into the eye. And it is the first structure, but covering the cornea is the tear layer.
Oh, of
And
course.
so when people will say, my vision gets blurry, I can find maybe no prescription, but I see their tear layer is not as thick, it's not as uniform as it should be. So we have to look at that in more detail. Now, there's 3 layers to the tears. There's a mucus layer that holds it to the, to the eyeball. There's the watery layer in the middle, which has all the nutrients in it. And there's a fatty or lipid layer that covers the front.
Okay.
This lipid layer comes from the glands inside your eyelids.
Okay.
So that every time you blink, you're squeezing out some oils, and that covers the front of the tears.
Oh.
Now, that's important because the tears, that watery layer that has all the nutrients in it, will evaporate very quickly. And this lipid layer seals it in. And that's what maintains the uniformity of the tears. So what we need to do is make sure that people are getting, a good oily layer in the front of their tears and not
Do
evaporating
the
too quickly.
omega-3s play a role in that?
Omega-3s are part of the picture, yes.
Okay.
Not the whole thing, but they are part of the picture.
So when you say dry eye syndrome, it sounds like I just need to put drops in my eyes, but it's more than that?
Well, more
Tell us
than
about
that.
the drops.
Yeah, we can use drops to some degree, but they tend to disappear quickly.
Yes.
I prefer a nutritional approach internally, where we're using some nutrients, vitamin A, vitamin D, some other antioxidants and other factors.
So many of these eye drops are medicated for allergies and other. And that's
Those are
not
different.
What
Those are
you
different
don't want
allergies.
to use those.
Yeah, don't want to use anything that gets the red out. There's a new one coming out that's not too bad, but everything else, the typical get the red out stuff, it makes your eyes redder.
All right.
Yeah.
We have a break, but when we return, let's talk about eye emergencies. What to be on the lookout for. We'll be back.
May savings time is here again with our annual cancer-free celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioInnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's Bionutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. Talking about the sunshine vitamin, vitamin D3, makes me think of other ways to bring a little sunshine into our lives. The often quoted columnist of Pertinent Proverbs, William Arthur Ward, once wrote, "A cloudy day is no match for a sunny disposition." This echoes what Solomon said in Proverbs 15:30. A cheerful look brings joy to the heart, and good news gives health to the bones.
Every day, about 200 million Americans do not get enough of a key essential mineral.
That mineral is magnesium. The typical American diet does not supply enough.
And magnesium is so important. It protects bones and helps more than 300 different enzymes in the human body perform efficiently.
That's why BioInnovations offers chelated magnesium capsules for oral use and topical magnesium gel to be applied to the skin. That's 2 forms of magnesium to meet your daily needs.
Scientific evidence points to chelation as the best method of vitamin and mineral formulation.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health.
Because chances are you are one of the 200 million Americans who need more magnesium every day.
Again, that number is 888-442-2128. Call today. Ask about the AutoShip program for additional savings. To help you get a copy of Dr. Anshel's book, Smart Medicine for Your Eyes, we have a great special for you today. With your purchase of a case of noni, whichever type you want, the regular, organic, or concentrate, you'll get Dr. Anshel's book on maintaining eye health free. This is a great opportunity to also get an extra copy to share with your doctor or a friend who needs it. The special is for today only, so be sure to call and get yours soon.
We're back. We're having a wonderful discussion with Dr. Jeffrey Anshel today and discussing his book, Smart Medicine for Your Eyes. You know, doctor, our eyes are so precious to us, and there are scenarios that can put us in acute danger of losing our vision. Let's talk about some of the most common eye emergencies you experience.
Well, fortunately, pain. If you have pain in your eyes, typically it's the front, the cornea, or maybe even occasionally pressure inside the eye could cause some pain. But if your eyes hurt for any reason, you know, you feel like you get a lash in there or some, you know, foreign body, and you think it'll work its way out. Well, if it doesn't, you know, it can cause some damage over time.
Inflammation of the eye,
right?
You know, things like that.
Yeah, the pink eye is the problem, right?
But that's not really an emergency.
Well,
we want to take care of it.
It could be because pink eye, there's several forms of pink eye, and that tends to be the most contagious type of disease known to man. So we can transfer from one eye to the other, or to, you know, put it on a face cloth or a towel, or transfer it to somebody else. So it's very contagious. So it's something that definitely needs to be addressed.
What about shingles or herpes into the eyes?
That's another thing.
That's a real problem.
Right. Yeah, that tends to come out on the skin, but again, you know, skin around the eye is very, you know, prone to it. So that needs to be seen right away as well.
Conditions that may not hurt, but all of a sudden, I don't see right.
Well, the biggest ones are flashes and floaters.
Okay.
Now, floaters,
that's a common question. These
very common question. Now, floaters can be very normal because before birth, we have blood vessels actually growing through the center of our eye to feed the front part to grow. And just before birth, all these blood vessels dissolve, in theory. Okay, so to leave the center core of the eye, the gel part, clear. Well, not everything dissolves. You get these little pieces of cell that are floating inside the eye in the center gel. I like to relate it to bananas in the Jell-O. So you got this gel there, you got these bananas suspended in it, and that's kind of what it feels like. Now, as we get older, this gel inside the eye starts to soften up a little bit. So what'll happen is these little cells will start moving around. Now, what they'll do is they'll get closer to the retina, and then we look at a wall or a computer screen or the sky, and then it'll cast a shadow, and we see it. And all of a sudden, we see a floater.
I've seen them before.
Right.
Yes.
And I've had them for as long as I can remember as well.
Me too.
And you see the same ones over and over and over, and they just kind of come and they go, and depending on the lighting that you're looking at.
You get used to them.
And if there's a couple of them there, they're perfectly normal. You see about 100 of them at once, you're in trouble.
What does that mean?
That means there's probably some kind of an inflammation going on in the back of the eye, and you need to get to a doctor quickly.
Yes.
And typically an emergency situation.
You don't put that type of thing off.
No, do not put that off.
Doctor, you give so much good information in this book. I'd like to ask you your frame of mind when you sat down to write this. What were you trying to accomplish with this book, Smart Medicine for Your Eyes?
Well, what I tried to do was put myself on the other side of the chair.
Thank you for that.
Yeah, putting myself in the patient side and thinking, now how am I going to learn about this in about 2 minutes or less? And just, you know, cut to the chase and just say, look, what is this? How do I deal with it? What are my options? And so, again, taking it from the patient's point of view.
And you also talk about herbs and vitamins and exercises roles and minerals and various foods.
There's so
that's
many
not so easy to find.
There's so many different options out there that people, well, when I was in optometry school, every day was, wow, I didn't know that.
Yeah.
And gee, how did people figure this out? So, I mean, it's been a wow factor for me ever since day one in optometry school. So I figured people need to learn this and they need to figure this out because as a child, I maybe had 2 eye exams in my whole life, you know, and my parents never thought about it, and parents don't think about it. They think the pediatrician handles the vision thing. Well, the pediatrician,
not so much.
They're great doctors,
Yes,
but their vision, you know, expertise is limited.
We count on ophthalmologists and optometrists, we doctors. We do, because no one knows it all.
Exactly.
We need help with it.
Right,
so.
right. And that's why we're a specialist. You know, we specialize in eyes. But I kind of took it to the next level and said, okay, well, yes, eyes are a specialty, but yes, they're connected to the body. And I'm looking in the body when I'm looking in the eyes. So I need to know what's going on in the rest of the body.
Absolutely.
And again, nutrients will make a difference.
Common eye products. We touched on this before with the dry eye drops. Are there some better than others? Or some, you know, some people get in the habit of doing something over and over and over. Can some of these products lead to troubles if we do too much?
Yeah, absolutely. Well, that's the problem is some of the red, get the red out drops cause a rebound phenomenon, which
kind of
means
like nose spray.
It makes your eyes redder.
Yes.
And it's good for the company bottom line because you keep having to use the drops, but it's not good for your bottom line. So it actually makes your eyes redder in the long run. Now, there is a new one coming out from the company Bausch & Lomb. They're eye people.
They have a good reputation.
Very good reputation. There's a new one coming out called Lumify, and that's one that will reduce the redness without that rebound phenomenon. However, if your eyes are red for a particular length of time, there's a reason. And so what I like to do is say, look, if they're red, there's a reason. And, a lot of times I find they're just dry eyes.
Yeah.
And if they're drying out too quickly, they're going to get red. So there's a lot of things, causes.
So when I was a young man, contact lenses were really hitting big. And I tried them for a while, and I found them very irritating.
Right.
Are they better at the contact lenses now than 45, 50 years ago?
Yeah.
Yeah? I hope so.
Are cars better than horse and buggy?
Absolutely. Tell us about the contacts.
Well, I could do a whole hour on contacts alone, but in general, the contact lenses are almost available for just about everybody if they want them. So we have a lot of options: bifocals, multifocals, daily disposables, so you never have to think about them. So there's a lot of options, and if you want to look at alternatives to glasses or surgery, contacts are certainly an option.
All right, good. Well, folks, we'll be back for the wrap-up in just a couple minutes.
Savings time is here again with our annual cancer-free celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioInnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's Bionutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. I'm Cindy Becker for Your Health at a Glance. Each year, more than 76 million Americans contract food poisoning. Most cases are caused by tainted fruits and vegetables, especially contaminated leafy lettuce. But poultry causes the most food poisoning-related deaths. To prevent food poisoning, follow these simple rules. Thoroughly wash all fruits and vegetables. When preparing any kind of meat, wash your hands, utensils, and work area before preparing any other food. Cook thoroughly chicken and ground meats. Store leftovers in the refrigerator immediately. Look for expiration dates when you shop. If you use reusable grocery totes, wash them periodically. And finally, use spices such as garlic and oregano to inhibit the growth of bacteria that cause food poisoning. Food safety lowers your risk significantly of getting sick. For Your Health at a Glance, I'm Cindy Becker.
Is your life out of balance? It may be. The average American consumes far too many omega-6s and not enough omega-3s. This creates an imbalance.
So what can we do to get back in balance? We can eat a healthy diet.
And most of us need to supplement with omega-3 rich fish oil. Fish oil contains omega-3s with DHA and EPA, fatty acids that promote good brain and heart health. So reduce omega-6 in your nutritional plan and boost omega-3 to get back in balance.
To help you do that, BioInnovations offers two products, the Fish Oil Complex and Omega 369, both formulated for your health and well-being. So how do you choose? For highest levels of DHA and EPA, choose the Fish Oil Complex. For a balanced formula, choose the 369. Go online at bioinnovations.net or call 888-442-2128. Ask about the AutoShip program for additional savings. To help you get a copy of Dr. Anshel's book, Smart Medicine for Your Eyes, we have a great special for you today. With your purchase of a case of noni, whichever type you want, the regular, organic, or concentrate, you'll get Dr. Anshel's book on maintaining eye health free. This is a great opportunity to also get an extra copy to share with your doctor or a friend who needs it. The special is for today only, so be sure to call and get yours soon. Your Health is brought to you by BioInnovations, trusted products for your health and well-being.
Welcome back. Doctor, in the few minutes we have remaining, let's give everyone an idea of the 3 or 4 things we should all be doing, whether you're 5 years old, 6 years old, all the way up to 85, to help protect our eyes. 3 good things to do.
Well, the basic thing is to get your eyes examined on a regular basis. Typically, every year.
And you're not just promoting business, are you? No,
I can't imagine everybody wanting to come to Southern California to see me, but that would be wonderful.
I've been to where you live. It's beautiful. I wouldn't mind going. A good eye exam does things for us, doesn't it?
Yes, it gets us aware. You know, it opens the awareness of what's going on with our eyes. And again, because the brain is so able to make sure we have clear vision, if one eye becomes distorted or blurred or something like that, the brain will just tune it out and we go with the clear one.
That's the amazing thing about the eye. It tends to overlook, or the brain.
The brain tends to
overlook those
We can
things.
compensate.
We can compensate.
That's why we have 2 eyes. If one goes, we can use the other.
So have regular eye exams. If you think there's a problem, there probably is.
And even if you don't think there's a problem,
okay,
you know, that's actually the best part, because routine exams can pick up things that you would just never guess, and just amazing what we can find out and tell you in a routine exam, because there are very few pain receptors in the very back of the eye. And then, you know, what you're looking at, you know, if you're working on a computer long hours, you know, you may need low power glasses that just get your eyes to relax a little bit while they're doing all that focusing. So that's important.
Okay. All right.
Or, you know, dry eyes to maintain, you know, the health of your eye.
Is there a nutritional program? Is our good multiple vitamin, does it play a role in maintaining our eye health?
Yes, there are dozens and dozens of companies that make eye vitamins, okay? The ones I recommend are actually full spectrum multiple vitamin and mineral supplements that have all the eye stuff in it, the lutein, the zeaxanthin, the acetyl-carnitine, and all these other factors that help promote good eye health. But they have all the other vitamins as well that, you know, for general physical health as well. So again, a full spectrum multiple vitamin.
Should we wear our sunglasses when we go out in the
all
sun?
the time?
Helps to protect?
Yes. And you got to be careful, because you'll see in the drugstore these over-the-counter drugstore glasses, sunglasses, and it says UV protection. Well, you can get cheap distorting sunglasses that block UV light.
And then I get a headache because I can't see.
It clears it. And what I do in the office, I have people come in with their sunglasses, and, you know, I've got the projector that projects the letters on the chart, and I'll hold the lens over that projector, and sure enough, the letters disappear.
Disappear.
Yeah, so it distorts it that much. So we, you know, good quality sunglasses.
Do you have a new project on the horizon?
My next book is called What You Must Know About Dry Eyes.
Will you come back and talk about that one with us?
I will be here.
We'd love to visit with you on dry eyes. Very common problem.
It is. Thank you.
Well, you've outdone yourself again, Doctor. We know we can count on you. Smart Medicine for Your Eyes. Highly recommend this book. Have one in your library at home, and you can refer to it as situations arise. Folks, thank you for your kind attention. We'll see you again tomorrow here on Your Health. Bye-bye, everyone.
Hippocrates once said, "Let food be thy medicine and medicine thy food." So why do 9 out of 10 of us not eat enough vegetables daily? It's because we don't always know how to incorporate this practice into our busy lives. Instead of removing bad foods, start by adding healthier foods you prefer. You'll soon discover better foods you love will crowd out unhealthy cravings. It's not crazy, just healthy.
You know, the world is changing. You watch it on television every day. It's unbelievable It's unthinkable.
Today on Love a Child, we are helping people. No matter what is going on all around the world and all the bad reports you hear, there's good reports happening here. God raised you up to be a partner for the children here who cannot speak for themselves.